Whenever I get a question and I'm suspecting some type of vasculitis, and the vasculitis is probably infarcting the kidneys or the GI tract, I'm thinking about polyarteritis nodosa. It affects medium-sized vessels for the renal infarctions and also the GI infarctions, and it also has a very distinct pathophysiology. What you have is basically segmental. It's transmural inflammation of the arterial wall, and it also damages the internal and the external elastic lamina. What this causes is both the lumen narrows inside these arteries, and also you have microaneurysms. The way you diagnose this is through angiography. You have microaneurysms and segmental and distal narrowing, and you can also do a tissue biopsy, which will show non-granulomatous transmural inflammation. And also important to remember that polyarteritis nodosa has a correlation with the underlying disease of hepatitis B or C. This is because of immune complexes. The gold standard way to diagnose this is actually biopsy, but if you did an angiography, this is also diagnostic. And it's not only infarcting just one major vessel in your abdominal arteries, it's multiple. Now, the patient can present with some more generalized symptoms before you have any occlusive symptoms. You'll have fever, some weight loss. On the skin, you can see nodules, levator reticularis, even ulcers. And renally, you can see hypertension, of course. In the nervous system, it can cause headaches, seizures, and like I mentioned in an earlier video, mononeuritis multiplex. And musculoskeletally, you can have myalgias or arthritis even. And this does make sense as far as the pathophysiology, because what you have eventually is fibrinoid necrosis of arterial walls, and this type of thrombosis or luminal narrowing causes tissue ischemia. This elastic lamina damage will slowly form microaneurysms, and it'll cause rupture or bleeding, even to that of joint spaces, which is why you can have arthritis. Now, what if I check blood cultures and it comes back positive? Well, I would start thinking about maybe bacterial endocarditis if I'm having infarction of multiple organs, but it's very rare, and very rarely do septic emboli from bacterial endocarditis really end up in the mesenteric vessels. Anytime I have some sort of renal occlusion, now that we're on that topic, in a female, I definitely also think about fibromuscular dysplasia. That's very high yield. And of course, while we're on the topic of vasculitis, if you have a young smoker, don't forget about thromboangiitis obliterans, and you get to see finger ulcers, gangrene, and infarction, and the treatment for this is to quit smoking.